I'm reporting some malpractice and misconduct at Inova Alpha Neurology. My doctor was Dr. Cochran, and 3 out of 4 of her colleagues, neurologists, at the practice, that is 75% of her colleagues, resigned because they did not want to participate in the misconduct. They resigned in unison, abandoning the patients and abandoning the medical school student all at once. And I first started seeing Dr. Cochran in January of 2013. I had a very old head injury, which initially I had migraine, concussion type symptoms, and then when I was treated for migraine meds later on, some of the meds like Inderol and Tegretol do in fact work on the heart. Well, my symptoms changed, and I think I did get some cardiovascular symptoms, but it's not the type that you would recognize to be cardiovascular symptoms, and also some stenosis of the carotids developed that reduced the blood flow to the brain, and that actually did a good thing. It actually shut off the migraine headaches. So I was left with numbness and dizziness in the head, and so I was kind of satisfied with the status quo, so I basically didn't get any medical treatment for about 8 years, and it didn't really, and the condition was very stable. So Dr. Cochran has a 90-minute exam. Mainly it was just talk, kind of chit chat, but so she didn't do a good job about actually conducting a physical examination, and she also ended up focusing on all the problems originating out of the head, even though something like stenosis of the carotids would give you symptoms like numbness and dizziness in the head. So anyway, she focuses in on the head, and she orders testing accordingly, which is, and one of them was MRI of the brain without contrast. I chose a really cheap place in Maryland. I live in Maryland, and anyway, what I didn't know was this place was so cheap that they're actually run by a non-medical individual who was recently convicted of defrauding physicians, and he had a felony conviction, and a physician in New York actually signs off to be the director, even though he's never in Maryland. And the technician also, I guess, is that poorly qualified. So when I went in for the test, the first part, which is without contrast, went through just fine. Then he administered the contrast intravenously, and that also went through okay. There was no problem with the contrast. He in fact went ahead and completed the first post-contrast sequence. But then, because of the cardiovascular problems that I had, including the stenosis up into the carotids, sufficient contrast did not remain in my brain. And that should have been diagnostic in and of itself. It shows why I was having my symptoms. But this tech is playing a video game on my body, and he decides to get the contrast into my head at any cost. So what he does is he pretends as though a vein shut off when it really didn't. Later on, I found out that the veins were perfectly fine in the arms. But what he did is he injected into the back of an artery in the left hand, and he also attached an extension tube, and so he sent a large dose of material up the left hand at a high force. Now, you're supposed to inject into the vein because the vein slowly takes the material up to the heart and then rapidly distributes by the artery. But he intentionally injected into the back of the artery. Now, if you did it accidentally, there would be warning signs like blood spurting and a swollen hand. But he bypassed all that. He used such great force. I know what his plan was. He was trying to send it up the left hand, up to the shoulder area, and there it should meet up with the vertebral artery and get into the brain, entirely bypassing the carotid, the heart, the lungs, and so forth, just to get the contrast material into the brain. So when he did that, he he permanently destroyed the ulnar artery in the left hand, and there's no pulse. And the only way I can fix that is to basically get a new artery put in, basically, which is taking a vein graft from somewhere else and putting a new artery in my left hand. So that's the kind of damage he caused. And so when he sent it up at a high force into the brain, I had some pre-existing calcifications in the vertebral artery in the brain. And the more recent testing shows that those calcifications were all dislodged and they were flushed into different parts of the body. And then also the high pressures that were being sent into my brain caused swelling in my head, and also a swelling in one of the veins on the left side. The jugular vein was distended, and you had this large landslide of debris and flow coming down from the head to the heart, and the returning veins, including the jugular, could not keep up. And on my top of my chest, I have what looks like varicose veins, but varicose veins on top of the chest are not normal unless you're like Mr. Olympia. So they are on both sides of the chest, and they normally form as collateral circulation when there's some kind of obstruction in the middle. So, and there's actually one of the veins is actually seen coming from the neck area, comes all the way to the shoulder, and then it joins up with another vein at the shoulder, gets bigger, and goes to the heart directly, bypassing the jugular and the other large veins that return to the heart. And also what was found on the testing is that he caused an aneurysm on the ascending aorta. And the aneurysm is at the exact same size and same location as was John Ritter's aneurysm 2 years before he died from a dissected aorta. And the radiologist was really he doesn't have the story about what happened, so he was really surprised about how I could have an aneurysm, because unlike John Ritter, the rest of my heart was looking really good. I actually have less calcification than a normal person my age, and I don't have, that includes the heart itself and within the arteries. So I have a really young, healthy looking heart. At the same time, I have this crazy aneurysm. Literally, that's caused by an injury. And also, when I went back and I looked at the CD later, it showed that the test, which was supposed to take 35 minutes, it took 2 hours, and also there's 1 hour in the middle which is unaccounted for. So I'm fairly certain I was unconscious for 1 hour, and the tech never got any help. Anyway, I returned to Dr. Kulkarni. I told her what happened. Now, nobody knew at that point that the guy injected in the artery. I said that there was a problem getting the contrast into the vein. And she also saw, and I also told her that the tech was always checking up on me as though I suffered a stroke or something really serious, as though I had brain damage from what happened, and he wanted me to answer him always in complete sentences at that point. So, and then because Dr. Kulkarni is so incompetent, because Dr. Cochran has some kind of a personality disorder, he can't get any worthy neurologist to work for him, so he actually gets the bottom of the barrel neurologist, and this Dr. Kulkarni is such. And she didn't recognize that there's nothing she did which caused the problem. She was thinking that my pre-existing condition was to blame for the problem, but it really was not. the problem was because all kinds of people with all kinds of heart conditions, so forth, they go in for this test and they don't have any problem. I mean, they have the problem where you have the sluggish flow into the brain, but they don't have the problem of any harm being caused. But the harm was caused because this MRI tech did something wrong. And this kind of same presentation shows up in patients who are hospitalized for a long time with all kinds of severe conditions and all kinds of tubes coming in and out of them. But that's just a part of doing business. So she thought my precondition was so serious, that's what resulted in the problem, when that was not the case. So it's not the problem of her missing the previous conditions. It was entirely caused by the tech. So she starts covering it up as though she caused the problem. In fact, when I told it to her first, she told me I misunderstood. She paced around the room. She made a sound of fright with her mouth, and her body was shaking. So, and at the end of the test, she took 20 minutes, and at the end of the test, she took 20 minutes, and she went back and deleted. Well, she took 20 minutes and she altered the records from the first records, and she went back and deleted the fact that she even ordered this test in the first place. Now, obviously, anyone would know that she ordered the test, even though she deleted it. And what she should have been doing was, if she were going to alter the records, she should have gone back and bolstered her case for ordering the test in the first place. And she didn't. And so during the test, she actually tries to get me to discount some of my earlier symptoms, which could be considered cardiovascular, even though they weren't really bothering me. One of them was rapid weight gain, and she said, oh, you probably got 20 pounds of rapid weight gain in a month from using a treadmill. So, and then she changed the topic and she began to treat me for migraine variant. Migraine variant is basically some migraine symptoms without the headache itself. Now, we all know the numbness and dizziness were actually coming from outside of the head, so they would not be considered a migraine variant. But anyway, and then ultimately on the record, she put down that she was treating me for migraine prophylaxis, even though I did not have a migraine headache since 2005, and this is 2013. And she first gave me one migraine medication. It was a small dose, so it has some side effects but no lasting harm. Then she sent me to a primary care for getting blood pressure medicine. I did. There again, some minor side effects, but no lasting harm. And then it came to the month of May, and she had told me that she will prescribe one drug at a time, and verapamil would likely be the next drug. So I called her for the verapamil, and at this point, she has all the past history. She knows all the problems going on, and she also knows I didn't tolerate even the most recent medications well. But she goes ahead and prescribes the verapamil at a high dose and a 90-day supply, the maximum, 2 refills, simply to get me to keep me at bay. And at that point, verapamil was basically the worst drug anyone could have prescribed to me, because verapamil exclusively works to weaken the contractions of the heart and to work on the cells where the electrical system of the heart is located. And so it weakens the heart in that way as well. And it did. Within 5 days, I had to stop because I was getting very severe cardiovascular symptoms. Now, the symptoms were not the heart attack type symptoms where you have your chest feeling tight. So it's not the heart attack. It's literally the heart being weakened, and it's as though you have a power grid for a large city which is very insufficient. So you have fuses blowing when you have more demand, and so you can do some things and you can't do other things, and you can't do a lot of things in combination, kind of thing. So but they were definitely recognizable as cardiovascular symptoms. But I waited 2 months to see if they would go away on their own, and they didn't. Then I reported them to Dr. Kulkarni, and instead of her helping me, what the practice did, I never suggested malpractice or even complained anywhere. I just told Dr. Kulkarni in a letter. And what this practice did, Dr. Cochran did, they assembled a group, a risk management team. Well, if they were ultimately going to help me, it was okay. But the risk management team, essentially a death panel, and I was told by a nurse there one time when I called in that Dr. Kulkarni is in a meeting with some doctors, lawyers. Well, she said Dr. Kulkarni is in a meeting with some doctors and some other people. And now we know who they were. They were the lawyers and they were the management. So they were all meeting together, and instead of trying to figure out how to help me, they were trying to figure out how to conceal the harm and to see if they can get away with it. And the plan they came up with was to call me in for an appointment, and they ultimately wanted to do some kind of opposition research. They want to see if I was able to convince another doctor that I have these problems, and if they'll be easily visible. So the practice manager he repeatedly calls me and sends me many emails. Usually it's a nurse that does this, but the practice manager did so because he basically works for the management. So, and he's very friendly, and he's repeatedly telling me in emails. I have the email messages saying, yeah, just come in and make an appointment, and Dr. Kulkarni will take care of everything. She's reviewing everything. She'll discuss everything. So basically everything is taken care of and everything is okay. I just have to come in for that appointment. And obviously when I came in for the appointment, it was kind of just a setup to see what I have, not really to treat me. And they just want to see if they can get away with it. So Dr. Kulkarni just opens up the appointment with saying, how can I help you today? Even though she knew exactly what's going on. And so nothing really got done in that appointment. And then a few days later, I called the practice, contacted them again, and they ignored me. And then I went and saw another physician, and that physician said, I have to come back for better records from Dr. Kulkarni, or I have to come back for more treatment from Dr. Kulkarni. So I told Dr. Kulkarni all this. I sent them the stuff, but still they ignored me. And a few days later, I had to go in for a root canal procedure. And I had one just like that 1 year prior, and I didn't have any complications. But this time when the local anesthesia, the nerve block was put into the mouth, it seemed right away that all the anesthetic went right into the brain, and the left half of my head was really numb for a long time, and I also had some lasting complications from that. So essentially my neurological symptoms, originally what I had, intensified, and I also got some minor issues with vision and hearing, which were all long-term. Now, the endodontist, the dentist, they did nothing wrong. It was Dr. Kulkarni's duty, especially when I was trying so hard to get her to address the issues and give me proper records. It was Dr. Kulkarni's duty to tell me what was going on so that I could have passed this information on to the endodontist, and he would have come up with a better plan to deal with the situation. And so after this point, I make a complaint to the board, and even at that point, I'm not really accusing Dr. Kulkarni of doing any harm. So I'm really trying to give them a lot of different chances to actually come through and just take care of the problem and kind of avoid a lawsuit type situation. And they don't. But they do tell me repeatedly I can come and get I just have to fill out a form, I can get my records. I finally do fill out a form and send it in, and they don't send my records. And then I call the records tech, and she says, well, she doesn't know what's going on. She's not really involved, but she says that I she just looks it up. My records are so short, I can just come in and get the records as well. And so that's what I did. On December 17th, just a few days before Christmas, I went ahead to get my records, and I was met with the same person I saw I was leaving the last time. And the last time when I was leaving, she said to the other employees, "That's what I like about him, he's always smiling." And it kind of just picked up where that left off. So she right away was about to print out my records. But just when she went to hit print, she saw the first page of the records. It's a large defamatory statement put in by Dr. Cochran. And Dr. Cochran, I never even met Dr. Cochran, so why is he putting a defamatory statement in my records? The records are for the physician that actually treats you. It's not for a doctor who has never even seen you. So it's a one-page letter, and it takes, she reads it out loud, and it says, at least the first sentence, "This patient has been dismissed from the practice because," and then she doesn't complete the rest loudly. She reads it to herself, and she has a real look of shock on her face. So it takes 5 minutes. It was that long. It's really meant to harm my future care with any other doctor or in an emergency room. So basically, I go to an emergency room and something awful and untrue is written about me on my records. And so after that point, she goes in the back and she doesn't come back. I guess she doesn't want to participate in what's going on. Someone else comes back and tells me to wait. So I do wait, and like 20 minutes later, the practice administrator, Carol Jones, shows up with 3 police officers with her, and I ask her why she called the police for this, and she actually says that they are here for something in the back. So she never made an indication to me that I was unwelcome, and so she releases the records to me in a sealed envelope. I ask her to open the envelope. Now she's kind of frozen stiff at whatever is going on. She's really scared because I don't think it was her plan to call the police. And so she kind of does everything I say, even though it's kind of implicating them. She opened the envelope, and the first thing I noticed was there's whiteout on the page numbers, and she didn't even bother copying the pages so that the whiteout doesn't show. And then I asked her to make a new copy, and she did give me a new copy. So now no one can say that I put the whiteout there myself. I have 2 different timestamps. And then I had to inspect those records, and because of what Dr. Kulkarni actually wrote in the impression, which is her opinion about what's going on in the first record, she actually wrote that I have problems with visuospatial tasks, that I'm slow with them, and in fact the testing for visuospatial tasks is actually working with a sequence of numbers and letters. So literally, if I had to check over the records at that point, just by what she said, I was supposed to have all kinds of problems. It would take me much more time than normal. So since it was taking so much time, the cops who were there, they became frustrated because it was like 2:45. I think they're supposed to work with the schools as they get released. So one of them actually says to me that you are this close to being arrested. And I tell him that, well, I ask him for what, and he says for trespassing. And I tell him, well, nobody told me I'm unwelcome. In fact, the practice manager even said that the police were actually there for something in the back. But anyway, at this point, since I heard the word trespassing, even though no one asked me to leave, I just go ahead and leave. And also in my record from the initial visit, Dr. Kulkarni said, because of the problem with the visuospatial tasks, I have a problem with driving more than 25 minutes, that I need to rest in the middle. But in fact, I did drive more than 25 minutes when I came to the practice, and the people at the practice really didn't give me a chance to rest. And basically, I was forced to drive back home more than 25 minutes, which is basically 23 miles on the Beltway from Fairfax to Silver Spring. So she actually, they actually caused something which could have harmed public safety, but ultimately I reached home safely regardless. And then when I inspected the records, I found all kinds of problems, which were the records were actually time-stamped on the weekends. Friday late at night, Saturday, Sunday. Now this is done because the software allows you to go back and create records for weekends when the doctor doesn't have access to the software. So even though all my visits were on weekdays, we are talking about a doctor's office, not a hospital. All my records have dates showing weekend timestamps, and then also the records are so misaligned, and some lines just have like one word each. So there's extensive alteration on the records. If you want to get a written version which is much more clear and also shows all the evidence, just go ahead and email to me at fairfaxneurologist@gmail.com, and I can just send all the attachments to you.